Information about the hazards of asbestos is still being gathered. However, it is now known that breathing asbestos dust can be fatal. There are few cures or effective medical treatment for asbestos diseases. The emphasis must be on preventing the diseases in the first place. This means following recommended occupational health and safety procedures. The word asbestos comes from the Greek word for incombustible. There are two main groups of asbestos, amphibole and serpentine, and three common forms: white asbestos, chrysotile; brown asbestos, amosite; blue asbestos, crucidolite. It's prepared for use by mechanically breaking the minerals into groups of fibers. These fibers are resistant to heat and to most chemicals, and are known for their physical strength. Because of these properties, it had a wide range of uses. There are many products in everyday use that have had asbestos in them: brake linings, clutch plates, gaskets, heat-resistant textiles and fabrics, filters for industrial chemists, building materials such as cement pipes, boilers, paints and floor tiles, spraying of asbestos as an effective fire-resistant coating for structural steel. Sprayed asbestos was an efficient sound absorber, and so it was used for its acoustic properties. No building that has asbestos is allowed to be demolished without first removing the asbestos. The ultimate goal is for Australian workplaces to be free of asbestos. There are federal and state laws that control the removal and manufacture of asbestos products. WorkSafe Australia, the federal body, has set an occupational exposure standard for fibre concentration for the air breathed by workers. These measurements must be calculated using the membrane filter method. All states have legislation controlling the health and safety aspects of asbestos removal. These acts vary from state to state. Check your state's legislation. All asbestos removal contractors must be licensed. These licenses are renewable every 2 years. A great deal of information about the health hazards of asbestos has been gathered. All forms of asbestos can cause disease. These arise from breathing in asbestos fibers over a long period of time. We breathe air in through our nose and mouth. The air goes down through the voice box and windpipe to the large and small air tubes, leading finally to the spongy part of the lung. Down there, very small blood vessels wrap around the small air spaces so that the oxygen can move into the blood and the carbon dioxide can move out. Asbestos fibers can only affect the lungs if they are breathed in from the air. Fibers cannot get into the lungs through the skin or from being swallowed. Fibers have to be in the air before they can be breathed in, and asbestos materials which are sealed up and not disturbed do not release fibers into the air. Living or working in a building which contains asbestos does not lead to asbestos fiber exposure, so long as the material is not disturbed. Serious lung health problems can be caused by asbestos if and only if large numbers of fibers are breathed in and stay in the lungs for many years. Such large numbers, they need to be millions and millions, could be breathed in from extremely heavy exposures over as short a period as a few months, or from low exposures every day for 20 or 30 years. There are 3 serious lung conditions which can be caused if large numbers of asbestos fibers stay in the lungs for many years. The first is asbestosis, which is a scarring condition of the spongy part of the lung, and this causes slowly increasing breathlessness. It's not a cancer condition and is not necessarily serious. In some cases, however, it can be debilitating and even fatal. There is no direct treatment, although smoking should be avoided. The second condition, which is ordinary lung cancer, can be caused by smoking. This cancer grows in the air tubes, and it can cause breathing difficulty, coughing of blood, and pain in the bones. Although it is common in smokers, lung cancer is a little more common in people who have had long-term exposure to asbestos. Lung cancer is always serious and is often fatal. If detected early, it can be cured. The third condition, mesothelioma, is a rare cancer of the skin on the lung surface. This is not related to smoking and causes breathlessness and chest pain. It is always serious and nearly always fatal. Treatment can relieve discomfort, but cannot cure the condition. If a worker was to have an average exposure of 0.25 fibers per milliliter every day, that might give a lifetime extra cancer risk of 5 in 1,000 workers. No worker in the asbestos removal industry today would have an exposure even approaching this level. This 5 in 1,000 risk is quite low and is much lower than the risk of lung cancer from smoking alone. That risk is about 70 in 1,000 smokers, or about 7%. The asbestos risk is still serious and can be minimized by correct work practices and protective equipment. So, asbestos, if inhaled, damages people's lungs. A respirator must be worn at all times. It is the final barrier. The only thing that stands between you and asbestos lung problems or cancer is your respirator. Methods of minimizing the amount of asbestos fibers in the air is important. However, even during wet stripping and using negative air, there can be high levels of asbestos fibers. Your respirator can effectively protect you from asbestos lung disease. When working with lagging and sprayed insulation, continuous flow respirators should be worn. High concentrations of airborne asbestos dust may be generated, and a high level of protection is required. The continuous flow respirator offers the best protection against high dust concentrations. When asbestos sheeting is being removed using correct procedures, the concentrations of asbestos fibers is much lower. The half-face respirator with Class M filter would be satisfactory protection. Your respirator offers you effective protection only if it is used correctly. You should be shown how to inspect the mask for cleanliness and defects. Check the valves and filters. How to replace these parts if required. How to fit the mask. How to test the mask for proper fit. Some people cannot work in an asbestos work environment. This includes people who have beards or wear glasses, as either of these may prohibit the mask fitting effectively. You should be trained so that you understand these procedures to make sure that you are effectively protected. You should have your individual respirator to care for and maintain. It is your health and protection that is at risk. Coveralls are designed to protect your body from asbestos contamination. The hair on your body can trap the fine asbestos fibers and make decontamination very difficult. Boots, gloves, and coveralls are very important. After work in the bubble, the coveralls should be treated as asbestos waste. Contaminated coveralls must never be worn outside the work area. There are 4 main types of protective clothing, and the respirator is the most important of all. Vacuum cleaners used include a high-efficiency particulate air filter, HEPA. This filter is designed to trap the fine asbestos fibers which would pass through normal filters. These HEPA filters must be treated as asbestos waste on replacement. It is your responsibility to make sure that you carry out decontamination procedures conscientiously. If you don't, you expose yourself, your mates, and possibly your family to the risk of asbestos. Before you leave the working area, remove excessive asbestos from your clothing and footwear using a vacuum cleaner. You then enter the decontamination unit where you shower fully clothed to remove all visible asbestos. On completion of showering, remove your coveralls and place in the bags provided. Then you move on to the next cubicle where you take off your underwear and place in the bags provided. Do not take off your respirator, as this is a dirty area and is still contaminated. Now you enter a second shower. Here, you wash yourself thoroughly, paying special attention to your hair. Remove your respirator and clean it. All the water from the decontamination unit should be filtered before it passes into the sewer. Dry yourself with the towels provided. Carrying your respirator, you step into the change area and get into street clothes. Every time you leave the work area, you must follow these decontamination procedures. Great care must be taken when preparing the area to be cleaned. The work bubble must be sealed using high-quality tape on all plastic joints and where the sheet meets any other surface or around areas where pipes penetrate. Foam strips or filler foam aerosols may be easier to use in large areas of penetration. The decontamination unit should be connected to the work bubble. Supply airlines, electrical leads, hose and other supplementary equipment is inserted through the plastic and carefully sealed. A negative air extraction fan system is installed. When the workspace has been completed, a visual inspection is carried out by an independent qualified person. A smoke test should be carried out. Methods of asbestos removal may vary according to the type, but there are basic steps to follow. Thoroughly wet down the asbestos surface using a fine mist spray of water. If possible, wet down beforehand to allow saturation to be reached. But do not over-wet, as excess water can cause damage. Remove the bulk of asbestos using scrapers or other hand tools. When the bulk has been removed, wire brush the surface so that no visible fibers are apparent. If some areas are difficult to get to, small probes or toothbrushes might be necessary for access. As the asbestos is removed, it must be placed in a 200-micron clear, heavy-duty plastic bag. As a visual guide, it should be about half filled. This bag is then sealed. After decontamination, it is placed in a second bag of the same strength, which is clearly labeled asbestos and sealed. These bags are stacked, ready for removal from the site. They are removed to an approved government dumping ground. All surfaces within the bubble must be wet wiped before an independent person carries out an inspection. All tools, equipment and bagged waste must be cleaned and decontaminated before being taken from the work area. To prevent any remaining fibers becoming airborne when removing the plastic, a fine mist spray of an approved PVA sealant should then be applied to surfaces from which the asbestos has been removed and to the inside surfaces of the bubble. Air monitoring will then take place. After the air monitoring results have been cleared, the dismantling of the bubble can commence. All the plastic used must be rolled, then placed into 200 micron bags. These bags will then be sealed and disposed of in the same way as the bags of asbestos waste. All equipment is sealed and removed from the site. Finally, the surfaces behind the plastic walls will be wet wiped and then the floor thoroughly vacuumed using an asbestos vacuum. The risk of contracting an asbestos-induced disease has been found to depend on your exposure to asbestos. It may take 10 to 25 years for an asbestos disease to be diagnosed. Play it safe and reduce the risk of cancer caused by asbestos exposure. Health and safety in the workplace is up to you. Remember the procedures. Your health depends on it.